Good morning, everybody. I'm Mohammad Rafieetary. I'm here to present this paper on suprachoroidal delivery of an investigational ABBV RGX-314 for diabetic retinopathy. This is a phase 2 altitude studies. These are my list of disclosures. This paper has been sponsored by Regenex Bio, but I have no financial disclosure as relative to that paper. We all know that diabetic retinopathy is a global public health. There is about 20 million people with diabetic retinopathy in the US, Europe, and Japan. Although anti-VEGF has been approved for diabetic retinopathy, less than 1% of these patients are currently being treated for it. This disease usually affects younger patient population, people in their 45 to 50. Early treatment with a longer lasting therapy can potentially modify the nature of this disease. We also know this is a spectral disease, so as you go from the early stage to more moderate and severe diabetic retinopathy, the vision-threatening events increase. Those are diabetic macular edema and conversion to proliferative disease, which both puts the patients at risk for vision loss. There we go. So it would be very interesting to have a one-time in-office injection of a gene therapy that could potentially either decrease the level of the vision or stabilize the patient, but more importantly, stop that progression to the vision-threatening events. An investigational in-office ABBV RGX-314 is for treatment of diabetic retinopathy. This combines a vector and adeno-associated virus, ABV or AAV8, and a gene fragment antibody of anti-VEGF that reduces the vascular permeability. Therefore, it reduces the progression of the disease. The gene or the vector itself over time has been improved from an earlier AAV2 to AAV8, and as you can see on this slide, it has more effective gene delivery to the retinal pigment epithelium. Anti-VEGFs, either monoclonal antibodies or the fragment of monoclonal antibodies, have been FDA approved for several years now for this treatment. So the ABBV RGX-314 is a gene-coded anti-VEGF delivered by this virus. So the combination of these two is the agent called the ABBV RGX-314. The study design, there were 5 cohorts, but for this paper we'll talk about cohorts 1, 2, 3, and it was a dose escalating therapy. So the first group got 2.5 to 100 billion genomic copies per eye. The level 2 dose was 5 times 100 billion gene copies. And there were 2 groups in that. So the 4th and 5th group got higher dose, but we're not going to talk about that. So in this first 3 cohorts, no patients needed prophylactic steroids. So it is, again, FDA approved, and FDA looks at 2-step reversal of disease as a standard of how diabetic retinopathy can be managed. And this was actually done by the Panorama study, where this became a standard for treatment of these patients. As far as distribution of the demography of the patients was fairly equal between the control group and both dose escalation groups of these cohorts 1 to 3. And some of these patients had previously received anti-VEGF therapy in the past 36 months to the study design. So as far as adverse events, the treatment was very well tolerated with minimal adverse events, and in those few cases where there were some associated adverse events, it was determined that it was not related to the drug. So if you compare the control group to the 2 dose escalations, you can see that in the control group, only a few patients had self-reduction of the disease. Some patients were stabilized, but most of these patients over the course of the study actually got worse. If you look at the dose level 1 on all patients versus dose level 2, in the dose level 2, most patients were stabilized and many patients got 1 to 2-step reversal of MPDR, which is very significant. So if you look at patients that had moderate to severe MPDR as opposed to those, because there were some of these patients who had early PDR in that first representation. The patients that had only MPDR, a significant number stabilized, and a significant number of these patients had 1-step or 2-step reversal of disease. If you look at the vision effects, you can see that the control group to the patients who receive the level dose is significant. So in conclusion, because I'm giving the 5-minute warning here, this suprachoroidal injection, as you can see in the video, is an office procedure, is fairly rapid. One-time treatment can show 100% at the level 2 level, the second level, 100% stability of all those patients. 70% of patients achieve the improvement as opposed to 25% the control group. 0% of these patients got worsened as opposed to nearly 40% of the control group. And there were only 4.2 adverse events or visual threatening events as opposed to the control group that had 37.5% in disease progression per se. Thank you all very much.